Hello guys, let's look at gastrointestinal procedure. This is the Nclex success. These procedures are just unique to the gastrointestinal system. They can either be used to diagnose a gastrointestinal problem or to treat a gastrointestinal problem. Let's begin with the first one. The barium swallow is also called the barium meal. It is an examination of the upper GI tract under fluoroscopy after the patient drinks barium sulfate. The medication is taken in by the patient, is ingested, and then they withhold food and fluid for up to 8 hours before the procedure can be carried out. Because the barium can cause gastric or intestinal or bowel obstructions, it does not have to stay within the GI tract. So to remove it from the GI tract or to excrete it from the GI tract, we use laxative to remove it from the GI tract. That's the post-procedure management for barium swallow. Patient goes fasting for up to 8 hours, and within the first 24 to 72 hours post-procedure, we have to monitor the stool. The stool will appear chalky white for the first 1 to 3 days after the procedure. Then we talk about the capsule endoscopy. It is called capsule endoscopy because what is being swallowed appears like a capsule. The capsule itself, it is a camera that is swallowed, goes into the GI tract and take a couple of pictures. Those pictures are transferred to a computer and then analyzed. The procedure can be done to detect bleeding or other changes occurring in the gastric lining of the small intestine where you're going to have most absorption occurring. There's a little small box that is attached to the patient. That box saves the pictures or the photos that are taken by the capsule along the GI tract. In this procedure, the patient goes to the doctor office in the morning, swallow the capsule, walks around and come back a couple of hours later, and then the pictures are transferred to a computer and then analyzed after that. Patient goes fasting for up to 3 hours before the procedure. That's about the capsule endoscopy. Then we have the gastric analysis. Now, in the gastric analysis, they use an NG tube. A nasogastric tube is inserted into the stomach. The tube goes in, the tube you aspirate gastric content because it is the gastric content that we use to test for gastric analysis. So we collect the gastric content, and the gastric content is analyzed for 1 hour, meaning we take about four analysis to complete the test, meaning every 15 minutes, we analyze the gastric acidity or the pH, the gastric appearance, and then the volume after 15 minutes. So that is 4 times within 1 hour. Analyze it. Now, for the procedure, we might administer some medication. We might administer histamine or what we call the pentagastrin. Now, these two medications cannot be administered at the same time. We might either administer the histamine or the pentagastrin. They are administered mainly to stimulate the production of gastric secretion. That's the only reason why they are being administered. After the medication is administered, the patient might encounter some flush feeling that runs over the patient's body. So that could be a common finding for the Nclex. This procedure can diagnose esophageal reflux or other gastric conditions for the procedure. So the procedure, you have to go fasting for up to 12 hours before the test. And we have to avoid the use of tobacco, the use of nicotine, the use of chewing gum, because these food substances, they can either trigger the production of more gastric juices, which might alter the test result. We have to Refrigerate the gastric content for up to 4 hours if it is not being used when it is collected. Then we have what we call the GI endoscopy, or it is also referred to as the esophageal gastroduodenoscopy. So the test is done under sedation. The patient would they will administer anesthetic agents. It could either be a local anesthetic agent like a spray or gargle that will cause sedation. And then we go ahead and pass the endoscope into the esophagus to view the gastric walls, to view the sphincter muscles, to view the duodenum, and also other gastric tissues or other specimens can be obtained through this GI endoscopy. In this procedure, medication may be administered to reduce gastric secretion and relax the smooth muscles. So you have several different medications that can be administered. Like you have like the atropine and other things that help to lower gastric secretion production. All those meds are administered to reduce gastric secretion. The patient is positioned on the left side to facilitate saliva drainage and to provide easy access to the endoscope. We want to check the air patency. During the procedure, we monitor the pulse oximetry. We monitor the O2 saturation. We also be ready to carry out emergency procedure just in case the patient called during this procedure. We monitor vital signs, and the patient must be on NPO until the gag reflex returns. So after the procedure, patient stays on NPO until the gag reflex return. We monitor for signs of preparation like bleeding, pain, unusual swallowing. They will have high temperature. We also make sure we foster or we initiate or we encourage bed rest for the patient that are sedated until they become alert. Lozenges, saline, gargles, or other oral analgesic agent can relieve minor sore throat because they're going to cause sore throat. When you use the endoscope and place it into the patient esophagus, it might cause sore throat. And that's why we have to use the lozenges, the saline, gargles, the other oral meds to help to carry out the pain they're going to cause after the GI endoscopy. Then we have the endoscopy retrograde cholangiopancreatography, the ERCP. Now, the procedure, it is done to examine the hepatobiliary system. It is performed with a flexible endoscope that is inserted into the esophagus. It descends down to the duodenum. In this procedure for the Nclex, we have to remember where does it start and what is the goal for the procedure, meaning the indication. It is important to note the indication, to note whether they are going to be fasting or not, to note for how many hours, to also note the pre, intra, and post-procedure nursing management. Now, for this procedure, multiple positions are required during the procedure to pass the endoscope. So they will be doing different manipulation of the patient to get in different procedure until they can pass the endoscope into the alimentary canal or into the GI tract. The patient goes fasting for 6 to 8 hours. We monitor for signs of CNS depression, hypotension, oversedation, and vomiting. We want to make sure we inquire about previous contrast media exposure. What is the patient allergic to these different contrast dye or shellfish or iodine? Because these contrast media that can be used to carry out the procedure, it has a lot of allergies that it might cause. If the patient has had any other allergy from these dyes or from these contrast media, they cannot use this contrast media in this procedure. We monitor the vital signs until the gag reflex returns. We cannot administer anything by mouth. We monitor for signs of perforations. These are common things we check for the ERCP. Then we have the CT scan. The CT scan It is a non-invasive procedure that can detect tissue densities in the abdomen, in the spleen, the liver, the pancreas, and also in the biliary tree. It is done with or without contrast media. So again, assess the patient for any allergies to shellfish, to iodine, or any of these previously used contrast media within their medical history. Check for that. You want to make sure also for paracentesis, you want to ensure that the patient understands the procedure, that informed consent are all being obtained and signed. You want to make sure, check the vital signs, check the patient weight, keep them upright. You want to make sure you apply dressing at the puncture site, because the paracentesis, this one you have to go into the book or onto our slide and read them in depth, because there are important things about them, about the care after the procedure. You want to make sure you prevent bleeding, you check for bleeding, you put in pressure dressing to the site to prevent bleeding, you check the abdominal girth and the abdomen and the weight of the patient. Check all those things, they are important for the procedure. Then you have the stool specimens collection. Now, when we test for when we do stool specimen collection, we are inspecting the specimen for the stool consistency, the stool color, and also what occurred blood within the stool. Any blood occurring in the stool, all those things are tested when we do stool specimen. We also test for the fecal bilinogen, fats in the stool, parasites in the stool like worms, or in like helminthiatic conditions. We check for pathogen within the stool, food substances, and other macros that are not supposed to be part of the stool. All these tests are done to check the stool specimen. We collect the stool specimen, and if they are not going to be used right away, they must be kept up to 3 days, which is 72 hours, and they must be refrigerated until the test can be done. If not, it will be regarded as not effective, and we cannot use them anymore. If they are not kept in refrigerator for up to 72 hours, we cannot use them. Um, some specimens require a certain amount of diet to be consumed, so we have to check with the policy or where we work, check with those guidelines and know what specific dietary management are necessary with the procedure you want to do for the patient. Then we have the urea breath test. Now, the urea breath test, it is done mainly for the Helicobacter pylori, which is the H. pylori bacteria, what causes the peptic ulcer disease. This is wherein the patient will consume, they will also drink, like they did in the barium swallow, they will drink what we call a carbon labeled urea secretion or fluid. They drink it for 10 to 20 minutes later, then they check the breath test. So they will check the breath test to see whether the patient is having any reaction from from what was ingested. So certain medication may be needed and others might be avoided. Like what to avoid certain medication in the situation of this urea breath test. Those medications include antibiotics. We have to avoid antibiotics. Have to avoid any bismuth salicylate medication for up to 1 month before the test can be done. Sucralfate, omeprazole for 1 week before the test can be done. Cimetidine, famotidine, ranitidine, and other different kind of a H2 receptor medication. All of them have to be avoided. The pylori can also be treated by assessing serum blood tests through other means. Lastly, we have the liver enzyme test, different liver and pancreatic enzymes. These liver enzymes and pancreatic enzymes, when they are increased, definitely that means we have a liver issue. This will trigger us to do more in-depth liver examination. Like you have the ALT, the AST, the ALT, ALP, all these different tests are done to look at how the liver is functional or biliary obstruction. So these are important laboratory tests. You want to make sure and look at them for the Nclex because they are very important for our Nclex. The more we look at them, the better it becomes for the Nclex. Bye bye.